Are you planning to conduct a literature review but not sure where to start? In this video, I will take you through the step-by-step process of conducting a literature review, from defining your question to searching the literature and thinking about how you start to write things up. So let's get started. So what actually is a literature review? Well, a literature review is an objective, thorough summary and critical analysis of the relevant available research on the topic being studied. It should be systematic and comprehensive, and is an analysis of existing research studies and other published material related to a particular topic. A literature review is a type of research itself, but it is secondary research. That means it's desktop-based. And this video is aimed at people who are conducting a literature review, likely as part of their undergraduate dissertation, particularly for midwifery and nursing students. You might find it helpful to pause the recording at some points to make notes about your particular topic. And what's the goal of a literature review? Well, the goal is to bring the reader up to date with current literature on a topic, and it forms the basis often for another goal, such as future research in the same area. There are many types of literature reviews: traditional reviews, systematic literature reviews, meta-analyses and meta-syntheses. And the review that I'm covering in this presentation is somewhere between a traditional review and a systematic literature review. There are, of course, non-research reasons to do a review. For example, an assessment for an academic course. You might want to evaluate current practices. You might want to develop and update a guideline for practice, for example, if you're working in a clinical area. Or you may be developing a work-related policy that you want to be evidence-based. So how do we go about doing a literature review? So the structure of a literature review can be roughly divided into 4 phases. The first is to select your review topic. The second is to search the literature. We then need to select, read and analyse the literature, and then write up the review. So let's start with selecting a review topic. The first thing you need to do is define a question from your topic. Often your topic will be very broad. For example, you might know you want to do a literature review on breastfeeding. But you need a question from this, and it should be specific, clear and well defined to help determine the scope of your literature search, the inclusion and exclusion criteria as well. It should also align with the objectives of the review overall. You might find it helpful to watch my previous video on developing a research question here. You'll need to determine if your research is qualitative or quantitative. And from this, you should use a framework to help you develop your question. And your research question really is the backbone. It's the structure behind your literature review. So I recommend you spend a lot of time actually trying to get your question very clear and all the supplementary information around your question in line, because you will then find it much easier to search the literature. It's important when you've got your topic and your question that you make it specific. If your topic is too broad, such as the benefits of breastfeeding, you're going to be too overwhelmed. You'll find lots of literature on it, you won't quite know where to start or where to finish. But although your topic shouldn't need to be broad, you need to think widely. You need to know a lot about your topic. You need to know what is the current research on it. You need to know where the avenues for future research are. So although you need to refine your topic down, you do need to think widely. And I recommend that you do a quick scoping search so that you can see what's out there. You don't want to pick a topic and then discover that it won't be possible to do a literature review on this because there just isn't any primary research. Once you've established that it's feasible, pick a research framework. A framework helps you to structure your literature review. Common ones to use include PICO or PO, and SPICE or SPIDER, and there are many more, and you may find one that fits well with your project. I'm going to go over 2 of the common ones. So PICO, primarily used for quantitative research. P for population, so that's the people we're interested in studying. I for an intervention. So this is something that's happened to the population that may have happened on purpose in a controlled environment that we're interested in studying. Comparison. So we need to compare this intervention with something. Comparison is often routine treatment or no treatment at all. And we're also interested in some outcomes. So what's happened as a result of this intervention? If we take the example of breastfeeding, my population may be primiparous women, so women who've never had a baby before. My intervention might be breastfeeding support delivered in the community setting. And I could compare it to women who don't get any support. And outcomes, I might want to look at duration of breastfeeding, women's experiences of pain breastfeeding. PO, on the other hand, is primarily used for qualitative research. Here the population is the same. It could be anybody that you're interested in studying. I can use primiparous women again. The E stands for exposure, so this isn't necessarily something that has been done to this population, it could just be something that's happened anyway. And then the O is the outcome, so what was happening as the result of this. I can use my breastfeeding example here again, and my population is going to be primiparous women. My exposure may just be breastfeeding in the postnatal period, and my outcome could be their experiences, their views, their opinions, their attitudes. All things that can be measured qualitatively. Once I've set up my framework, I'll need to think about my inclusion and exclusion criteria. So inclusion criteria are the elements of the article that must be present for a study to be included in the review, whereas exclusion criteria are the elements of an article that disqualify the study from inclusion in the review. These really set the boundaries for the review. It helps you decide what kind of literature you are interested in and what you don't think is going to help your research question. Think that we always want research to be valid and reliable, and your inclusion and exclusion criteria, if they are tightly defined, can help you make sure that your research is valid and reliable. So if we think back to our structure, we've selected a topic, now we need to search the literature. So first you'll need to choose a database. As a general rule, a good literature review involves searching several databases, certainly more than one. Some databases are generic and some are subject specific. Frequently used databases for midwives include MIDAS, we may use Web of Science, we might use CINAHL. There are many available and you need to see what your library has, and it may be worth meeting with a specialist librarian who can help you determine which database is best for you to look at. Why can't I just use Google Scholar? So earlier you will remember that I said you should use Google Scholar for a scoping search, but really that's all you should be using it for. The idea is that you can quickly check what might be published. And the reasons for this are that it contains a lot of grey literature. So grey literature is anything that kind of isn't published in a journal, so book excerpts, abstracts, conference proceedings, etc. And although it is useful at some points to search the grey literature to strengthen your search strategy, it shouldn't be your only tool. It optimises what it believes to be important literature. So this means it shows you what it thinks you want to see, and it uses an algorithm to try and predict this. It's not replicable, so for example sources can be removed, and remember, for good research we want it to be replicable. Somebody else should be able to do what you did and find the same results. They're not going to be able to do that on Google Scholar because things may go. It also has limited sources. You would be surprised how many times you will look for papers on Google Scholar and you might not be able to find enough for a literature review, but when you do your full database search you do find a lot of articles. And finally, you can't filter or save results, and this really does save you a lot of time when you eventually conduct your search and you have 10,000 results. You need something to help you manage that. So, one important concept you need to get your head around is key terms. Keywords, also commonly called search terms, are the words that you search for in a database. Without keywords, you'll have difficulty finding articles. To find the keywords, identify the main concepts of your topic, and then think about synonyms and abbreviations that can describe your topic. In a database, you can't do what we call natural language searching. You can't ask the database a question, what are the benefits of breastfeeding, in the way that you can put that into Google. With the database, you have to break it down into these key terms. What should you do if your search hasn't worked? So chances are the first time you do it, your search won't work, so don't panic. You're probably going to have too many results, maybe hundreds of thousands, or too few, only 4 or 5. And there's some basic things you can do. If you didn't find many results, it is important to check that you've got the correct spellings. Think, do you need to search more databases? Have you actually searched the right ones that will contain the information that you need? Could you do things like limit the date range? Do you only want to find papers in the last 5 years? You can do that on a database. Can you search by language? Filter everything so it's in English or another language that you're studying in. It may be that you just need to go back to your concepts and refine them. So expect that this is what we call an iterative process. So you have to keep going back and refining your process until you perfect it. So we can now move on. So we selected the review topic, we searched the literature. Now we need to select, read and analyse the literature. So choosing papers. Once you've run your search successfully and you've come out with not 5 papers, not 100,000, you're going to need to start reading the papers. If you still have too many, you need to think, have I been specific enough? Do they observe the same population of people? If you have too few papers, it could be that your question truly is too narrow or too niche, and you need to go back to the literature and think about how you can widen up your topic. A key question to ask yourself is it research? You want to be primarily looking at research papers. Avoid case studies or editorials or opinion pieces. You then need to screen it and check that it fits with your inclusion and exclusion criteria. So ensure that it's looking at the right population, it's looking at the right intervention or exposure, and you're looking at the right outcomes. You need to screen titles and abstracts first. So look at the title. Does the title look like it's going to fit in with your literature review? If you think yes, then look at the abstract and read the abstract. If you're still confident that this is going to fit in with your review, that's when you can start reading the rest of the paper. And I always say to my students, read until you think, no, this actually no longer takes. No, this will not fit in with my paper. No, this will not fit the criteria for my review. And then you can stop reading it. Save yourself some time that way. You'll need to assess quality. So including a paper that is poor quality is going to reduce the overall quality of your literature review. You need to use an established framework to judge the quality of the research, and you should be applying that framework consistently across all papers. Common ones to use include the CASP Critical Appraisal Framework. You may wish to use Caldwell's framework, Holland and Rees, or another one that you have found. And you should use critical appraisal tables, which can go in an appendix of the dissertation or literature review to help you structure this piece of work and ensure that you are being methodical and using a systematic approach. You'll then need to synthesize the findings. You need to collect themes that are similar and consider what the findings mean as a whole. You need to find trends amongst all of the papers in your review. So finally, we've selected our topic, we searched the literature, we selected, read and analysed it. We now need to write up the review. So your introduction. Your review should have an introduction, and this needs to tell us why the topic is important. So why did you choose this? But not perhaps because you chose it because you thought it was really interesting. You need to use evidence to tell me why it was important. So tell me why this is an important issue for your profession currently. Then briefly summarise what we already know about the topic. Okay, what is out there, what's existing? Maybe there's a couple of statistics you need to put in. And then you need to explain to me, well, what do we not know about this topic and why should we know this? Why is it important for your profession that we know this information from your review? You're going to follow your introduction with the background, and here you need to go into much more depth than the introduction, but you are still continuing to introduce the reader to your topic and its relevance. Key things to discuss include policies or guidelines relevant to the topic, a discussion of current practice and how or why there is room for improvement. You can include statistics related to the topic. And a good literature review will include a summary of the current literature that is not included in your review already. A well-structured review will have aims and objectives defined. Aims refer to the general goal or purpose of the study, whilst your objectives are specific, measurable and time-bound targets that you need to achieve in order to fulfil the aim. So your aim is broad, but your objective is a small, manageable chunk that you're going to take. An analogy is going shopping for dinner. So my aim is I need to go and buy dinner. My objectives are I'm going to get in the car and drive to the supermarket. I'm going to buy a roast chicken and I'm going to take it home. Your methods. So your methods should be specific and precise like any good piece of scientific writing. It should be written like a recipe, so if somebody else followed it, they could replicate exactly what you did and find the same result. It should contain the examples of the keywords, exclusion and inclusion criteria, and the databases used. And to be honest, it should be relatively boring. This is not an interesting part necessarily to write. There is not much analysis in there. To some extent, you are describing what you did. It's also the part I actually recommend you start writing, because it shows what you did. It's therefore quite easy and it can feel nice to be able to get something down onto paper. If you are submitting a literature review as an assessment, you are going to need to include some critical analysis. So you will need to complete those critical analysis tables. And then you could also write a paragraph on all of the following topics within all of the papers within your review. These ones are taken from Caldwell's 2005 framework. So you would discuss the titles in one paragraph and you would say, for example, well, 4 authors had clear and concise titles, whereas the other papers had long and wordy titles. And you would say why that's a strength and why it's a weakness. You would go down and do this with the authors, methodology, population, etc. The best critical analysis will come from the methods section, because this is the most interesting part of the paper and where there is most likely to be issues with the paper's quality. So I would focus on that methods section rather than kind of talking too much about the title, the introduction, the conclusion, etc. Ethics. So you may need to discuss ethics in your dissertation, and in this section you can discuss ethics in relation to literature reviews. So are literature reviews ethical? Do they need ethical approval, etc.? The 4 ethical principles related to medical ethics. You could also discuss ethical issues from the papers in your review. This could go in your critical appraisal section also. You'll then have findings and themes. So you should synthesize findings from the papers included in your review. You do need to be unbiased, so don't necessarily go in there with an idea of what you were going to find. And care must be taken to avoid a description of a series of studies. The person reading your review, if they wanted to, they could just go and read all of the 8 to 10 papers you might have included. No, what we want to know is what new information have you found? What have you found by looking at all of these papers that you think, oh, that's new information, because you're able to collate everybody's findings. But do avoid broad, sweeping statements about the conclusiveness of research studies and your own research in the form of this literature review. We always want to be slightly tentative, slightly cautious in academic writing. Recommendations. So you should have some recommendations from your literature review. After all, this is why we conducted this review. It was so that we could change practice. These must be based on the findings of the review. Generally, you would probably have somewhere between 3 to 5 sets of findings from your review, so I would then expect a recommendation for each of these findings. And it's really important that you don't generalise. Don't give me a wishy-washy finding like, oh, we just need more research in this area, or oh, clinicians should put this into practice. Tell me exactly what you think should happen. It's also very common to do a finding for policy, a finding for practice, and a finding for education. Limitations. So it's good to discuss what are the limitations of the review and focus on the limitations within your review, because you should have already discussed the limitations of the paper in your critical appraisal. And it might seem silly or abnormal to point out things that went wrong, but actually a good researcher is reflexive. So they reflect on what went well and what could have been better. And we want to see that coming out in your writing. Your conclusion. So your conclusion can consist really of 3 points. So summarise your key findings. Yeah, what were those headlines? What were those interesting things you found out? Tell me what this contributes to the evidence base. So why was it good? Why was it important that you found this out? And tell me, how can this knowledge be used going forward in practice? And finally, your abstract. So the abstract should be done last, but come first. It's a summary of the research for a reader to read before they decide to read the whole literature review. Obviously, if it's an assessment, they're going to be reading it all, but it still needs to be there. And I recommend you use subheadings to structure this. It only needs to be about 200 to 300 words, and subheadings can keep you on track. References. You'll have a long reference list. This might be the longest list you've ever done, so make sure they're carefully formatted, and my advice is to reference as you go. Either use referencing software or an Excel chart to just keep track of all those references. There is nothing more frustrating than losing a reference just as you're about to submit. This is a long piece of work, so you are likely going to have appendices. You might need a glossary. You might also include the PO or your PICO framework. You may have examples of your keywords, or you might have screenshots of your database searches. You'll likely have your critique tables or a critique framework. So some general good practice for writing up. Present the findings in a way that demonstrates your knowledge in a clear and consistent manner. Avoid long and confusing words and jargon. It's the quote from Einstein that if you can't explain it simply, you don't understand it. You don't need to use flowery language and long sentences and confuse your reader. You also need to make sure that you have accurate spelling and grammar. If this isn't your strength, ask somebody to proofread it, or read it aloud, or get your software to read it aloud, or ensure you're using an app like Grammarly for that spelling and grammar check. Thank you for watching, and good luck. The key thing to do is to get stuck in and get started, because with a dissertation, with a literature review, you are learning as you go.